The most important thing when selecting JAK inhibitor is consider benefits and risks in each patient. Benefits include, of course, efficacy and speed of onset of action. As for efficacy, upadacitinib ranks the highest, followed by tofacitinib and filgotinib. And as for speed of onset of action, again, it's same. Upadacitinib ranks the highest, fastest, followed by tofacitinib and filgotinib. And you also need to consider side effects of JAK inhibitors. The most concerned side effect of JAK inhibitor is, of course, herpes zoster. Especially East Asian patients have almost 2 times more risks than Caucasians. So you need to consider the risk of herpes zoster. And actually, the risk of side effects are inversely correlated with the efficacy. So filgotinib has the lowest risk of herpes zoster, followed by tofacitinib and upadacitinib. So you need to consider benefits and risks of JAK inhibitors in each patient to select one. The most concerned side effect of JAK inhibitors is, of course, herpes zoster. To prevent herpes zoster, you should recommend recombinant herpes zoster vaccine. Recombinant herpes zoster vaccine can be applied to immunocompromised patients. But data on the efficacy of recombinant herpes zoster vaccine for patients on JAK inhibitors are limited, but still you need to recommend it to patients if available. And other important thing is to inform the patient of the risk of herpes zoster. And if herpes zoster develops, patients should take antiviral drug as early as possible. So that is a very important point. Other than herpes zoster, you may need to consider major adverse cardiovascular event, venous thromboembolism, malignancy, but data suggests that those risks are associated higher age and smoking. So you need to avoid patients at the age over 55 years old or have a risk of cardiovascular events. And as for pregnancy, data are very, very limited in JAK inhibitors. So it's better to avoid patient who wants to conceive. That is my risk management plan for JAK inhibitors.